That's the flavor of 2020.
Right. All right. So, Bhavana, we're going to get started here. I think we are now streaming live, which is really awesome. So, welcome to the Heart of Small Business. My name is Cherie Clark-Moore, and it's been a little while since we've done an interview, but I'm really excited to be back on board again today. And today we have a really special guest. But let me tell you a little bit about why we do the Heart of Small Business first. So, we have amazing small businesses around the Woodlands and Spring and Conroe area all over. And sometimes we don't get to hear the stories behind why those small businesses started. So actually it takes a lot of courage to start a small business. And usually there's a great story and some real passion behind why people choose to take that leap and open their own business. So that's why we're here. We want to kind of share these stories and help you get to know our local business owners more deeply and show you what there is to offer around our local area. So like I said, my name is Cherie. I own Body and Brain Yoga up here in Conroe. And today I'm really grateful to have our guest, Dr. Bhavana Rao, and she is with Meridian Springs Primary Care. And I have known I knew your husband first, right, Bhavana, through our Toastmasters group, but then I had the pleasure to meet you too. And, I'm so excited for you to share your story today, because actually you have a really unique model for what you offer. And I can't wait to hear your sharing about how you got started, because I actually don't know that story. So I'm excited to hear it too. So let me ask you, you have Meridian Springs Primary Care. Tell us, how did you get into opening this practice, your practice?
Well, we have to go back 4 years back for this time zone when I was a hospitalist at one of the major hospitals here. I was there. It was my 4th year in as a hospitalist, and it was a great job, and I loved it. I chose the job and learned a lot on the job, but it was to a point where I was realizing that this cannot go on forever, because there is a finite amount of sleep deprivation one can experience and withstand, and work, in a sane manner. So I was very realistic about the limitations of the job that it would have on me. So I knew I couldn't continue on that forever. It was a time when a lot of the small practices were being bought out by hospital systems. It was a very unfriendly time to start your own practice. And then amongst the doctors physicians community, we knew how difficult it was to be a single physician practice in the insurance model, just because of the overhead, the financial burden, and the difficulties with handling insurance billing, all the back office work that goes into it. Plus, we also see a lot of patients a day to keep up with charting and code and completing the clinical work itself. So it's a very humongous task, and I've seen many doctors' offices and doctors just selling their practice to the hospitals just for the ease of life, and they just want to be done with the burden of such a practice.
Right.
So and that's when a colleague of mine who's a nephrologist was, we were having a friendly banter and in the hospital, and he always used to mention that you need to start your own practice. But then my question was, how am I going to handle everything when I know that it's set for failure? So it's a difficult task, and how am I going to have my own practice? That is when I read about direct primary care and the business models some of the physicians in the country were doing, were setting up their practice. It was, and the more I read about it, the more I felt like this is the direction for me. And that's a moment, like a moment where I was in touch with my heart, with my passion, with why I became a physician, and it connected all the dots for me. So in my heart, the moment I read about it and I was discussing with my colleague, I knew it, that this is it, this is what I want to do. And yes, it was extremely emotional moment that I was like, okay, this is just, I didn't think about how I'm going to do it, or what it entails, but I said, okay, I want to do this. And that is when I of course, had to share it with Sunil immediately. So on the way back home, I called him and I was telling him that, hey, I was reading about this model, and another physician had started this practice in Houston. So it's not just a magazine with an article on it. People are doing it in Houston. So I was very interested in, like, this is it, I want to start a practice like this. I didn't know how I was going to do it, but I just wanted to. So it was going, I mean, that in that during that time, Sunil was doing his MBA at Texas A&M, and he was open, or he was on the lookout for picking up a project for his capstone. And this was one of the options he considered, and he submitted an initial paper on it, which his professors liked. And then that's when the research began. And we had to find out if this was a viable model, if it was we were capable of succeeding. So then on started the business aspect of it. And we still didn't know that we were going to do it or not on paper, but in my heart, I'm like, this is the only way I'm going to survive as a physician. So even now I think about it, and it I just remember why we did it, why I changed on the days when it gets so busy, that I'm doing what I love, and nothing else can be better than that. So that's the story behind why I changed, why I switched over to the direct primary care model.
Oh, I love that. I love, I can see that spark of passion where you're just like, okay, this is it. This is it. It all comes together. And I think, that's what makes the heart behind the business, right? That passion and drive. And then, yeah, okay, we have to do all the business stuff too. But without that, actually, there's a lack of authenticity with business. So I really love that, you were inspired, and this is really, you come back to that moment when things get a little challenging. And I think that's what keeps you going, right? Especially as a small
Definitely,
business owner.
because I ask myself, would I do something else? Then the answer is no. This is got all the answers. This is exactly what what I would want from my professional life. So so then it's just a great balance, because once it gives me the control of a primary care office, and managing it in a very stable way. There is no pressure, pressure in the sense, there is no insurance pressure, there is none of the red tapes that we have to deal with, billing, coding, seeing about 30 patients a day.
Right.
That's a big stress, and it makes it very difficult. And I believe the core of the satisfaction I get from my job is to connect with my patients, and that model just doesn't give that time to have the connection.
Right. Yeah. And so I'm
It
so
boils down to that am I able to talk to them long enough? Am I able to solve their issues for what they've come in?
right.
So a 5-minute visit doesn't do that. So then this is the model that really works in that way.
Yeah, that's awesome. I mean, I think, that is such an important point. I know I've been kind of felt like a sheep at the doctor's office sometimes, in past experiences where you're just in and out and you're like, I didn't even catch their name. I didn't know anything about them. They had no investment in me at all. So it's great that your practice kind of allows you to have that connection, because at the end of the day, that's why we do it, right? I mean, you're there to help people. I mean, you have a healer's heart. You wouldn't be a physician if you didn't. So being able to share that with people is really important. And if you don't have the time because of, insurance, regulations and things like that, then I think this is a great model. So also, I don't know if you know, but Bhavana has 2 young boys. And she has a wonderful husband that helps her in the business too. And I understand one of your boys had a birthday yesterday. Is that right?
June is birthday month for us, because both of our boys are June 16th and June 25th.
Oh, that's so awesome. And how old are they again? Remind me.
They are 7 and 9.
Oh my gosh, yeah. I keep saying, every time I see Bhavana or a husband, I keep saying Bhavana is like Superwoman. I have no idea how she does it all.
Oh, no, 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 not at all. It's the same
Yeah,
grind, but my family and work keep me so happy that I don't feel it.
thank goodness, right? So let me
They
ask you another
anesthetize,
question.
they anesthetize the hardships.
I love that. Anesthetizer. I'm going to keep that one. I like that. So let me ask you another question, Bhavana. I want to hear from you. You know, you do such amazing work, and I can see so much that connection with patients. Can you share a story where, you know, your model and your practice and what you offer has really helped someone who has come to seek guidance from you? Is something come to mind?
Well, a few scenarios come into mind, and each, I think I can give a couple of examples which kind of signify different aspects of what we do. The first one is I had two patients. I've diagnosed cancer in several of my patients. And usually it's a rare diagnosis because by the time they come to primary care, maybe they've seen a specialist, they've gone to the emergency room for something else, and they've been diagnosed there.
Right.
I believe the reason that I have come across these new diagnoses is because I remember distinctly at least two patients not going to the primary care for at least 3 years, despite knowing there is something going on. And that is because of, first of all, co-pays and expensive testing. And just that it is just difficult to decide on going into a regular PCP because of the way they communicate with you, the way the visits are, and it is so impersonal nowadays.
Right.
So when I got these patients and I saw them for the first time, I did a full exam, and usually my new patient appointments are at least an hour. So when I saw them and I examined this particular gentleman, he had a big mass in his neck. It was a lymph node, and it was a big lymph node here. So then, of course, we got all the testing done. He had a high deductible insurance. So this person obviously was exposed to a lot of expensive bills with imaging and biopsies. We got all of them done for discounted cash prices. And then, of course, when we came to know the diagnosis that it was malignant, of course, I made the necessary referrals, and his insurance took care of the cancer treatment, surgeries, all those things. But again, I wanted to stress the fact that the person had not gone to a PCP because of the issues and the difficulties of getting into an office and just dealing with it.
Wow.
Also the expenses that somebody is exposed to once they go there, especially if they are going to pay cash for the initial evaluations and blood tests.
Yeah.
Another scenario, same thing. I had a lady, a very healthy lady, no other problems, young, who had breast mass, and this was also incidentally found, and she didn't have a PCP for a long time. So we could get her started immediately on an MRI, a biopsy, everything done for a great discounted rate.
Right.
And then, of course, they got into the system for further treatments for the cancer itself once we got the diagnosis.
Right.
So these two scenarios actually kind of gave me an insight that there are people there and they don't go to the doctor because of the expenses involved and because of the laborious process involved,
Right.
and they don't have a relationship with them. And that is one aspect of what we do. We spend a lot of time with patients. I get to know them as families, as individuals. There is a good relationship built there, and and then and they are free to come here. They feel comfortable contacting me for anything, small or big, anything.
Yeah, that's amazing. I mean, your accessibility is phenomenal. Like when you talk about that level of connection and care, I don't know if people realize, but how readily available you make yourself to your patients is phenomenal. And I know actually I'm a person that would really value that. And, you know, that's part of what I would look for in a primary caregiver for sure is, you know, a relationship. I'm not there just to walk in and walk out with a bunch of drugs. You know, I need a person to listen to me and to validate and to really kind of think outside the box and, you know, get to the root and understand maybe my family dynamics, all the things, right, that go into primary care.
Right.
Care, absolutely. So yeah, I know you have a very unique practice, and thanks for sharing those stories. They're amazing, actually, to be able to pick up, you know, and diagnose those cancer treatments, and then be able to do all the steps to enable them to get the best treatment very, very, very well and quickly as well, and not at a huge expense. That's part of the worry, right? Is for people to have those big expenses. So being able to help them with that is so great. Yeah, thank you for sharing. And then last question, I have one more question for you. So me originally not being from this country, navigating the medical system here is like, I don't know, like finding a needle in the haystack. I don't even know where to begin. So give me, if no one else, me some guidance on when do I go to the emergency room? When do I see a primary caregiver? What are my options and where should I go first? Give me some ideas.
Right. We have different healthcare scenarios where you see doctors these days. It could be your primary care of doctor's office. It could be a urgent care. It could be telemedicine. It could be ER.
Mm-hmm.
So I would start with the foundation, which is your primary care. The primary care doctor is basically your family doctor. You build a long-term relationship with the doctor. The ideal is to use the doctor's office for small, big issues, small issues, and maintenance. Now, when we talk about maintenance, we're talking about wellness. We're talking about, say, keeping your body, you know, as a well-oiled machine, just like car service.
Mm-hmm.
So that way you have less problems down the road. You're a healthy person as you age.
Mm-hmm.
So that is the foundation. That is the primary care office, which does a lot of things. It does screenings, blood tests, taking care of you when you're acutely sick, or making sure they're preventing illnesses from developing and giving you timely advice to change your lifestyle as needed.
Mm-hmm.
And the second one is urgent care. So urgent cares came across when the doctor's office got too busy and they didn't have time to answer your questions, or after hours they don't want to see you. Why? Again, insurance comes into the picture that, you know, they're not compensated enough, so it gets complicated. And then recently I had a friend of mine whose doctor's office said, hey, we are too busy, we can't take care of you, go to urgent care.
Oh,
and he's like, hey, why do I go to urgent care? I'm going to call Bhavana for this.
right.
So I said, yeah, see, that's the difference. So that's an easy example.
Right.
That, you have a sore throat or a headache, and then you call your doctor's office. Doctor says, you're too busy, we're too busy, we can't get you in until 4 days away. So then you end up going to urgent care, or you do a telemedicine consult. Now, just to explain, in the direct primary care in our clinic, I do my own telemedicine. So my patients can text me or call me, and we take care of all these issues, so that you're not talking to a stranger, but you're talking to your own doctor for these kind of issues that happen weekends and after hours.
Yeah,
and the next level is the ER. The ER is really emergency care. And when we think about the ER, we want to think about a situation that a primary care office cannot handle, like fractures, like chest pain, stroke-like symptoms, lightheadedness or syncope, especially in older, and any palpitations. Those are the kind of things that need an immediate evaluation, where it's very, very high-level care that you need. And that is what you get in an emergency room. Now, again, of course, because of the doctor's offices not handling a lot of the day-to-day issues or infections, acute conditions, a lot of these people end up in the ER because of bronchitis, because of the influenza. In the winter, in the influenza season, we see a lot of these people coming into the ER when they don't really need the ER. They just need to talk to their primary care doctor.
Yeah.
So these are for an example, these are the different levels of evaluations that you can have.
Right. Yeah, no, I appreciate, the point there. Like I've heard of telemedicine and I've used it once or twice, but being able to contact like my doctor who knows me and has all my history and all of that, like via those methods, uh, whenever I need it, that's amazing. I think that's such a amazing service that you provide. Well, thank you for clarifying that for me. So, all right, I get it now. I understand. So that's good. But Bhavana, I wanted to share just before we end, I wanted to put up Meridian Springs contact information for everybody. So let me share my screen here and put that up for you. So we have here Meridian Springs Primary Care. We have their website. You can always email and call. Like I said already, the biggest thing that I've learned about Bhavana's practice is she is always there. I don't know how she does it, but she is always there to answer calls and to really help people the best she can. So, Bhavana, I'm really happy that you joined us today, and I look forward I need to come visit your office. Oh my goodness. So I think we've tried about 2 or 3 times, but we will make it work. And I want to come and see your space and come and learn more. But I hope today that everyone, you kind of got to know Bhavana really well and can see, yeah, she's a woman of passion, man. It's amazing. So she really loves what she does. And I think you found a really great fit for yourself, Bhavana. I can see how you're really helping the community and everyone that you touch, including your family and your wonderful husband too.
Well, he's the reason I'm able to do it. And I should, my sincere thanks that to God, that I have such a great husband that's supportive and is basically carrying the load of, the business.
Right. Yeah. And he's listening too. So that counts, right? We love you, Sunil. All right. So, Bhavana, I know you're so busy, and I really appreciate you making so much time for us
Thank
today.
you, Cherie. This was so fantastic, and I hope to get to meet you soon.
Right. I know we haven't seen each other for ages, but yeah, we'll catch up soon. And I wish you all the best. Thanks for joining us today. And everyone else who's here, if you have a small business that you know of, if you're a small business owner, if you know someone who has a great story behind why they started their business, then please connect them with me. You can do that through the Facebook page. We love to share stories. We love to hear the uniqueness of our community and what makes us special. So again, thanks, Bhavana, and we will see you soon. Have a great rest of your day. Bye-bye.